Thank you very much for all of you to come to this community listening session. This is the fourth of this kind of events as part of the Alternatives to Incarceration project that SANDAG is developing for San Diego County. Before we start, I just want to remind you that there will be, or there is Spanish interpretation, simultaneous Spanish interpretation. So I will ask our interpreter to give us some of the basic instructions for those of you who want to listen to this community listening session in Spanish.
Hola, ¿qué tal? Les damos todos la bienvenida para esta reunión el día de hoy. Va a haber interpretación simultánea disponible. La sesión en escucha está siendo grabada y va a ser disponible en www.sandac.org/ATI-Study. Si les gustaría hablar, por favor levanten su mano. Los hablantes se les darán 3 minutos para hablar para poder asegurar oportunidades igualitarias. Los individuos pueden hablar más de una vez dependiendo del número de hablantes. La promoción de cualquier negocio o específico y su promoción va a ser desalentada.
Thank you very much. Do you mind giving them specific instructions on how to access the Spanish channel for this meeting?
No problem. Para poder seleccionar la traducción directamente en español, al final de la pantalla en su plataforma hay un icono de globo terráqueo. Al momento de dar clic ahí pueden seleccionar español para poder escuchar la traducción simultánea.
Thank you very much, Alejandra. And as Alejandra was saying in Spanish, this session is going to be recorded both in English and Spanish, and it's going to be available in our website at sandac.org/ATI study. As a general rule, you're going to be all as attendees, but if you want to speak, if you have some questions, please raise your hand and we will give you, we'll open your mic so you can participate. Also, as a general rule of courtesy, we are allowing each speaker 3 minutes to speak, to allow for the majority of attendees to participate if they want to. We're going to have a timer indicating the time that you still have to speak. And of course, we want to listen to your thoughts, to your comments, your suggestions, but we really want to ask you that please refrain to promote any specific business or service. This is a session that we will use as we are developing our recommendations for the ATI study, and we would like to hear more of experiences and comments and thoughts, and not for specific businesses or organizations. If we can go to the next slide, please. Today, we're going to have a very short introduction of the ATI study and the kind of the development of the research. We're going to present 5 specific points. We're going to provide you with an updated timeline of our research, and we're going to start sharing some of the results or some of the findings that we had in different aspects. For example, in the services for the community, in the barriers and obstacles to accessing those services for the community and for the population that needs them. An analysis of some of the best practices in alternatives to incarceration that we were able to document and to analyze. And 5, it's going to be some of the takeaways and recommendations that we have so far as part of our project. If we go to the next slide, please. So the ATI project is it has very or similar, have very different portions or segments. First of all, we analyze jail population data. Then the second portion is understanding who had continued contact with the justice system, especially after the COVID COVID-19 pandemic and all the policy changes that happened around that time. The third portion of the study is to document services needs, the availability, the gaps and the barriers for those services. Number 4 is identifying some programs or policies that have been successful or that have been proven promising, or are expanding in terms of alternatives to incarceration. And the final portion of it is a portion of the research that we're still developing, but it's a cost analysis of alternatives to incarceration. So we're trying to determine the cost of a variety of services that are used as an alternative to incarceration. Along those all those segments, we have been trying to gather community feedback in different ways. As we're gonna show or discuss a little later, we have been conducting community surveys, but also we had a series of community forums or community listening sessions back in the summer, as we were starting to develop this much more solid research. And so at this point, this opportunity that we have, this community listening session of this week and the next week, we're gonna help us wrap up the research and help us to draft the recommendations that we have as a conclusion of our research. If we go to the next slide, please. One of the important things to remember as a context of this research is how jail bookings have decreased over the last couple of years, especially, we all know, starting with the COVID-19 pandemic, as we can see in this slide, bookings decreased dramatically in 2020, and despite some peaks, they have remained low, or at least lower than in previous years. So in this context, it's important to know and to ask that population that is not going to jail, what are the needs, what are their needs, the services they require, and all the alternatives they have, as opposed to going to jail. And so part of what we're presenting today, or what we're discussing today, is some of those findings that we have developed or come up with during the course of our research. If we want to, we can go to the next slide, please. And by the way, we're going to be having some questions. We have some polls that we're going to publish here in the Zoom meeting. I will ask my team to ask the first poll right now, so you can provide a little more detail of where are you joining us from, and as we move forward, we're going to ask some other questions. If we can continue with the slide, please. Oh, sorry, just some of the things to remember. As we mentioned, the decrease in jail population, of course, had to do with the COVID-19 pandemic, but it has a deck of different reasons. From bail changes, closures of courts, changes in booking criteria, or early releases from jail. Everything, all of these aspects, all of these drivers contributed to what we're seeing now. And so the ATI study is trying to figure out what are the alternatives that we have, policy alternatives as we move forward in the reality such as the one we're in right now. If we go to the next slide, please. So as results from our community forums and our community surveys, we identified some of the most important needs for those at risk of incarceration with different levels of agreement. we found that at different moments of time and for different population at risk, the most important needs were housing, help with basic necessities, mental health services, employment assistance, transportation, and some substance abuse treatment. These needs were identified as, the most important ones that were mentioned during our community forums, but also as part of our community surveys, as I mentioned previously. If we go to the next slide, please. Along with those needs, we find significant barriers. And I think we have a poll question that's related to the previous slide, if I'm not mistaken. So if you feel free to ask the question whenever we go into that slide. And as I was saying, some of those needs are accompanied to big barriers for those clients who are in need of such services. We found that, for example, the majority of cases say that services aren't easy to get. They're hard to find about that specific service. The waiting lists are long. There are certain restrictions for eligibility, and it was harder, cumbersome to enroll. It's worth mentioning that we should mention that these barriers were gathered first by our community forums, our community surveys, but also we had a survey of providers. And so these are the most important barriers that were found among those three different mediums that we use to gather recommendations and gather input on these topics. We're going to allow a few seconds just to catch up with the questions that were posted. But we can move to the next slide, please. And as I mentioned, an important part of the ATI study is to find what has worked in other places, or even in the San Diego County. What services have been proven successful? What services are promising? In which services can we start looking at more closely when trying to implement something similar for the San Diego region? First of all, the best practice portion of this analysis followed the intercept model. And we're going to show a slide explaining what the intercept model is for those of you who don't know. But what we wanted to do is focus on best practices and policies, not only, as I mentioned, in San Diego, but also in state, national, and international level. We put an emphasis on those programs that were proven or are promising, that had specific outcomes. And of course, those specific outcomes allowed us to at least measure a little bit their success in a way. So we, for example, made an effort in include certain efforts when there were no formal evaluations. And what this means is, for some services that we couldn't, that didn't have any outcomes to be measured or analyzed, we still acknowledge their existence in some of the services or the services that they provide to the community, even if there is no way for us to measure their success. I think there is going to be another question coming soon. So, and this is this question number 3 is about barriers. If we can go a slide back just to read what were the barriers that were agreed to be the most important barriers to needs and services, so you can follow up the poll. And I believe we have another question for for best practices. So I will hold on just a little bit here so we can move forward. But if you can go to the next slide, please. And we're gonna, if you have questions, of course, about the needs assessment portion, we can provide more details if you want as part of this conversation. We just want to give you an overview of what the research process was and what were the focus that we had. And first of all, as I mentioned, we follow the intercept model, and so we divided the different practices, the different services that we could measure, that we can research based on the 5 steps of the intercept model. So if we move forward to the next slide, we can see how the different practices and examples that we found fall into the different intercepts. For example, in intercept 1, we focus on community level crisis response and diversion services, law enforcement assisted, crisis response and diversion services, and alternative treatment options, especially for those who were suffering for substance abuse and had substance abuse related offenses. Those services that fall in intercept 2 and 3 had to do with behavioral interventions to reduce failure to appear in court, collaborative courts, pre-plea, outreach and advocacy, correctional, educational, and vocational programs. And those that fall in intercept 4 and 5 related to comprehensive reentry services, post-release care services, and healthcare. And I think we have a question that had to do with the best practices. If not, let me know and I'll continue with the next slide.
Octavio, we do not have another poll question, but I just want to give people the time. If you haven't answered this question, please take the opportunity to do so. And if you're having any issues lodging your answers, just let me know in the chat.
Thank you very much, Sarah.
Oops.
Yeah, we of course want to keep the SANDAC portion very short so we can have more time to listen to your comments and recommendations. So I apologize for going so fast, but I see that there are some hands raised in the attendee portion. What I'm going to do is I'm going to try to finish the presentation, and I will then allow our participants to speak. If you have any specific questions or any issues related to the polling, you can write your comments in the chat. Can we now go to the next slide, please? And to conclude with this portion is, what have we found? What are the things that we are going to analyze as recommendations, or as our takeaways of this massive research project? First of all, it's just focus on prevention as much as we focus on reentry. That will be probably one of the first takeaways. I think there seems like the chat is disabled in the webinar. I apologize for this. So those of you who had your hands raised, if you had any questions related to to the polls, can you raise a question? Sorry, can you raise your hand again, and we'll give you, we'll open your mic. If not, if your question can wait, we just have a couple more slides. We can discuss it at the end. Tom Packard had a question.
This was just for the comment section, not about this.
Okay. Yeah, are you, please go ahead.
Yeah, I prepared a comment just for the open comment period, but I was waiting until you're done with your part of the presentations. Are you ready for the open comments?
Oh, okay, thank you, Tom. I think I'm just gonna, do one more slide, and then I'll open the floor for questions and comments. Thank you, Tom. I appreciate it. Well, and as you can see, just be mindful that not all services are going to be successful to all populations, and not all sizes fit one. That we ensure that the services are easy to get, and the important thing, and we heard that a lot, especially in the community surveys and the community forums, is the use of peer mentors as a way to help with engagement in this type of alternatives or services. And we found that some low-level offenders have frequent contact with law enforcement, and so it will be key to engage them in services that might not be easy, but are essential for them to keep going back in this revolving door of justice system contact. And if we can go to the next slide, we can just conclude with this portion. Again, as I mentioned, increased peer mentorship opportunities. Important thing that there is something that we can never forget, and this is the victims and the families of those who are at risk of incarceration, as an important factor of any policy or any service that we implement. And an important thing also that we found is that employment stigma, and how we can get rid of that stigma of being incarcerated as an alternative to allow individuals to go back to employment, both in public and private sector and partnerships. Next slide, please. And we posted a series of questions that we were interested in listening at for this community forums. But we would be very, very thankful if you can just tell us what you think about these and other questions. For example, what makes a good service? What programs or interventions would you like us to focus the most? If you had some funding, a limited amount of funding, how will you invest it? In which type of programs you would invest it in, why? And of course, we didn't present a lot of the results from the data portion of our research, but what would you like to see in a data analysis like this? What would you add that was not added or mentioned in this presentation? And again, what would you think it will be important or needed to implement these recommendations? Not only the recommendations that we are suggesting, but others that you might think of. And if you're not able or prefer not to participate in the forum, but you want to also be part of it, you can provide a comment or a response in writing at our sandac.org ATI study comment section. It's a comment form, so you can go there and just whenever you want, you post your comment in the form. And this concludes the portion of SANDAC's presentation. We want to It would be interesting to share the results of the polls before concluding these questions. Maybe would it be possible to see the results of the polls? I'm not sure if we're all able to see it. There you go. So now we're seeing that, yes, most of you coincide that housing is one of the most important services that population in risk of incarceration needs, mental health or substance abuse treatment. If we go to results of question 3, we can see that most of you thought that waiting lists being long are one of the most important barriers, followed by some eligibility restrictions, which in general makes sense to what we've heard and what we've seen. And we go to question number 3. And yeah, so what's the most waiting list, of course, being too long, and eligibility restrictions are there as well. Can we go to, and that was the last question as far as I understand, right?
Yeah, that was the last question that we pulled.
Okay, so we're gonna share the questions and the answers in our website later on. So if you want to take a look more carefully, those are going to be available later. So let's go to the portion where you ask questions and you give us comment and you give us feedback. If we can we can go to the slides where we have the timer so we can control the comments. There you go. And so we have Tom. Tom, please, now it's your turn. I apologize for not letting you make your comment then. But
oh no, yeah, no problem. Can you hear me okay?
Yeah, we can hear okay. Thank you, Tom.
I'm Tom Packard. I'm a member of Showing Up for Racial Justice North County, and I'm a professor emeritus in social work at SDSU. And I prepared an answer to that other set of questions, but I think I can connect them to the ones you just put on the PowerPoint that I hadn't seen previously. Your earlier question in other documents about greatest service needs, I don't have enough current knowledge of the service delivery systems in this field to identify specific needs, but I want to share my general concerns about the types of data you will have for your final report. Based on my review of your findings to date, I haven't found nearly enough information regarding specific services needed in particular communities. Your third interim report says you're awaiting provision of BHS data from county-funded programs. I think that data, ideally augmented with key informant interviews from service providers regarding service usage, waiting lists, and frustrations about no appropriate programs available for referrals to their clients, will be needed to show service gaps. You'll need these findings to make specific recommendations to the board about what types of services are needed, in what amount, and in what geographic areas. Service providers could also identify their staffing challenges for qualified behavioral health workers, which is another high priority for the board. And then these findings can be examined with the results of your best practices research to make sure that they're in alignment with the best practices. It looks like my time is out, but is that correct?
No, that's sorry, Tom. That was my mistake. Go ahead.
Yeah, I timed this to be under 3 minutes. So, okay, yeah, I was talking about, and I think I'll email this all to you anyway later, to make sure that the findings can be examined with results of your best practices research to make sure that the recommendations for additional funded services are based on the most appropriate evidence-based service delivery models. I also think it would help a lot if the qualitative data responses you've already gathered are collated to identify themes and better assess the extent of the problems and needs mentioned by respondents. And my time allows, just one service example I've heard about is the extent of available services. I know there are more CSUs than there used to be, but then referrals resources for people coming out of CSUs and otherwise coming out of MCRT and PERT. I hope other people can provide detail on those needs. And I think what I just said kind of connects with your questions just from a few minutes ago about deriving meaningful, no, I'm sorry. The question about, I was going to comment about the takeaways. I think I forget the questions you had posted, but anyway, I hope this can help you in terms of your further data collection and how you're going to put everything together. Thanks for your attention.
Thank you, Tom. And just to say a couple of things about your comment, and please feel free to comment on the questions that we posted initially as part of the community forums, or to refer to any of the questions that we raised at the end. It is as important, both set of questions, so there is no problem if you want to refer to one or another. And yes, one thing that we have to acknowledge is that we didn't want to make this presentation very data heavily, and therefore some of the important indicators are probably not or are missing from this presentation. But they're all going to be considered and they're all going to be present in our report. And as some of you might have already read, some of them we have included in our preliminary reports, and we will continue to do so until we publish the final report. So thank you, Tom, for your questions. And please, if you want to send anything, you can send an email to Sandag or post your comments in the comment form. Thank you very much. Are there any other comments, questions? I saw many hands raised. We have R. McGaffigan. Please go ahead. Your mic should be open now.
Unmute. Okay, thank you for calling on me. You know, there's some good information that you provided, but I think the elephant in the living room is that there wasn't anyone from like the law enforcement. I think one of the biggest challenges we face in the jails is a lack of transparency, and to be able to get data that would really generate, you know, what's going on, who's going through the programs, and what services they do provide. You know, I think it's important to understand what NavCare, who has a contract with the sheriffs, you know, how is that administered, and who's actually in charge of those services? Is it a sheriff, or is it the, you know, the actual professionals, mental health professionals? And so I think that, you know, a lot of the stuff you're doing is fine, but you got to look at it from a larger perspective. You know, if you want to reduce incarceration times in the jails, you know, I mean, you know, what are you going to do? You talked about having this evidence-based programs, but how are they going to be presented, you know, to actually be implemented? There's a number of counties throughout California that are already adapting different types of programs, as well as across the country, that would provide, you know, the best practices that you're talking about. So I think, you know, for me, I like to hear, you know, what are the nuts and bolts of that you're discovering, and two is how is this going to be administered and actually get the attention of the sheriffs?
Thank you very much. And can you just repeat your name again?
It's Richard McGaffigan. I'm on the Behavioral Health Advisory Board, and I'm chair of the Criminal Justice Committee.
Thank you, Richard. And yes, you're right. I mean, this is, as you mentioned, this is an evidence-based research. And so there are going to be limitations in terms of what we can, what information we can gather, what services we can analyze and measure. And in the end, as you pointed out, there is going to be like the most important portion is how these results, these findings are going to be taken and acted upon, if there's a possibility. So yeah, there are important questions that need to be raised, and this is an important place for us to discuss and comment about that. So I really appreciate your question, your comment.
Right, you know, the sheriff's got to be transparent. It would benefit them in their jobs that they do in the community if people could see some of the things they might be doing is great, but nobody knows. And what are a lot of the things that people question as, you know, they should be doing a lot better. And I think there's a lot of work to be done. Thanks.
Yeah, it is. Thank you, Richard. And you know, some of the nuts and bolts of those services and all the research, it's going to be it's going to be available, of course, in our final report. But yeah, please. Well, thank you very much for bringing this up to this forum. I see some other hands raised. I see Darwin. And Darwin is one of the members of our advisory group, part of the group that you know has followed this research process for very months, and he has been very active and engaged in this process. So thank you very much, Darwin, for coming today, and please go ahead.
All right. Thank you. Hopefully everyone can hear me.
Yes.
And Octavia, don't take this personally. My concern, you know, first and foremost, is for us that are part of the ATI and been doing the work. You know, typically we've been allowed to be participants when we've done a webinar, and that's not the case tonight. Then the other thing too is the chat is disabled, and that is just to me strange while we're having a listening session but no chat. The other thing I wanted to say is to support the concerns that the community members have brought up. Thank you, Tom, about the data. And that's true. We have really serious issues with the data that we've been provided with SANDAG and trying to connect that to policy recommendations. I would say that the good news is, of course, is that for San Diego, we don't have to reinvent the wheel. There are not only other cities that have done alternatives to incarceration, but they literally have the same format. So one of the things that we're using now is the ATI in LA and their report. And if there was a chat, I would post it in there. They have over 100 recommendations. They're really strong. They're clearly recommendations that are connected to the exact point of the ATI, alternatives to incarceration. Hopefully at some point we'll get on track with that. Our meeting was canceled this month. We've got a meeting in February. So hopefully we can begin to connect the data, usable data that makes sense for those areas where we can make a difference about alternatives to incarceration, to policy recommendations, and policy recommendations that have been adopted in other cities and are part of the national trend. And unfortunately, again, San Diego is really lagging. And it's a really key moment to try to connect us to that work and where they're really doing alternatives to incarceration that we can learn from and implement it here. So thank you. Thank you for those that have joined us tonight.
Thank you, Darwin. And first of all, I want to apologize for the technical difficulties with the chat. What I'm going to do right now is I'm going to post the link to our comment section in the website, just to in case you have anything else to add. I apologize for this. We'll try to fix the comment section for the next community listening session. And also thank you for bringing, you know, these important concerns that you've been, or that the advisory group have been discussing during the process. And yeah, that you have really played an important role, and we are trying to, we'll do our best to try to match the expectations, but at least we'll try to make the best analysis out of the available data. So thank you very much, Darwin, for coming today, and also for all your all that you've done and as part of the advisory group. I see Jerry Hall. Can we allow Jerry Hall in the room? Jerry, I think you can speak now.
Yes. Okay. Great. Thank you. Well, I mirror the comments that have been made by the other folks, especially Dr. Fishman. And I just made a quick bit.ly, but it's if you go to bit.ly/LAATI report, you can get access to that report and see the Los Angeles work. So it's bit.ly/LAATI report. And my belief is that this meeting is an example of the reticence of the system, and this is not just pointed to you, but just generally the reticence of the criminal legal system and the behavioral health system to share data with the public so that we can give more informed feedback. It's really frustrating to have a question in a presentation that asks what we think about the data, but the only data we saw was one metric, which is how many people were released early. And speaking of that, there was in January 2020, there were 6,559 people in our jails. 2 years later, there's 3,689, a 43% drop. And it just blows my mind. We have a 43% drop, and I don't see crime raging out in the streets, and I don't see a lot of blowback from that. And I'm wondering why those 43% of the people were in jail in the first place. And I think if we stop talking about all the data and all the programs, and we start talking about the customer, the consumer, the person that is involved in the legal system, and we put them in the center, they are screaming for help. And by that, I mean that they're throwing all kinds of signs that they need help. And when the community is just not cognizant of that or not sensitive, that we lose a lot of opportunities. So I think one thing we could really do is pull those people that were released in the last couple of years and find out, or at least look at their crime records and see how many recidivated and how many, and what did they do, and just learn from that. So I think too that the report that you're working on right now is something that was created with the December draft, and now it's January 25th, and we won't see that report until February 28th. And that's really frustrating to know that there's a draft report sitting there that we could be giving you feedback on before the draft gets released in February. I'm assuming you have a draft because you spoke of it earlier in the other meetings, and it just seems that a much more open way to have a lot more participation from the public is by letting us see that draft so that we can give you better feedback. And I think just holding on to it so tightly is not helping. So I just encourage the different system leaders and people in the process right now of just think about how can you be more open and forthright with data. And even if it's rough and dirty and not all cleaned up, we understand that, data is messy. And once we can start working together, we can, I think, be a lot more innovative and not miss opportunities that we can take to help keep people out of our jails and into programs and services. So I'll leave it at that. I know the time's up. Thank you.
Thank you very much, Sherry. And thank you very much because I know you've been participating in many of these community forums in the past, and you've been following closely what we're doing and what and you've been very active. So I really appreciate you being part of this study. One thing that I wanted to mention is that it seems like the comment section should be open now, so you might be able to start posting comments on the chat. If not, please let us know. And yeah, unfortunately, Jerry, was not possible to release the report before the community forum. The plan originally was to have it, but there were some issues with the data that we had to go back and review, and we're hoping that we can release this as soon as possible. And and you're right, we're not presenting a lot of data here, so it's really hard for you to provide any meaningful comments about the data that's not presented. So this is a good suggestion, and maybe for the next community forum, we will try to include a little more specific data and indicators, so we can have a much more deeper conversation about that. So thank you very much, Sherry, for bringing this up. I see that Robin Sales is next. Let's just bring her to Robin. I think you should be able to speak now.
Hi, my name is Robin Sales. I am the co-chair of the Criminal Justice Subcommittee of the Behavioral Health Advisory Board. And I'm also on the executive committee, and I'm speaking for myself as a community member. I was appointed by Tara Lawson-Raymer over a year ago. And I'm trying to represent my community, and what I hear from the community over and over again, that if there is no transparency from the sheriff's department, your report is going to fall flat and it will be for nothing. So if after 1 year in May, when you give your final report, and the sheriff's department refuses to be transparent with the data, and I'll just reference the MCRT that Tom spoke to, not able to get information from the dispatch on how many calls are being diverted to the MCRT away from the sheriff's department or the other police departments. It's going to be problematic because the community will lose confidence in your process, and you will have spent a year on collecting data and it's going to go nowhere. So I just want to say that I support Tara Lawson-Raymer and her quest for good data and very good, strong recommendations. I also would like to support what Darwin said about the LA ATI project and the recommendations. And I'm hoping to see more best practices and evidence-based work coming out of this committee. Thank you.
Thank you very much, Robin. And yes, I mean, as we move forward, this research is only gonna, be one part of the discussion, but all the different stakeholders have to come up, and we'll have to come together and try to find good alternatives. But at least we want to do our part by providing anything that it's evidence-based that can be taken into consideration as we move forward. I see that Robin McNulty.
Yeah, another Robin.
Sorry, thank you, Robin. Please go ahead.
Sure. My name is Robin McNulty. I work at Family Health Centers of San Diego. I'm speaking as an individual. I'm also a member of the Integrated Health Committee at the Los Angeles Regional Reentry Partnership. And I have attended any public ATI meeting since the very first one. And I just want to thank Darwin for raising up that the chat was closed until a few minutes ago. One thing that I wanted to also lift up was that we are referring to things like substance use disorders as substance abuse, and also using terms like offenders. In this community, people should know better. So I'm kind of surprised that the members of the advisory group have not been advocating for humanizing language, person first language. And I hope in the future that Sandag will consider using more humanizing language and referring to members of our community. The other thing that I am shocked to not see more of is speaking about harm reduction. We know that incarceration is the biggest risk factor for homelessness. People that are not stably housed are most at risk for contact with law enforcement, and that they are hugely at risk for things like substance use disorders. For a long time, we know that safe consumption, safe use sites, and decentralized safe consumption sites are extremely effective, not only in tackling things like the opioid epidemic, but in preventing overdose deaths, and in providing gateways to health, healing, mental health services, referrals to SUD treatment, all kinds of things. And that is something that until very recently, the Board of Supervisors barely even allowed safe syringe exchange to be legal in the county. Also, a recent environmental assessment with Family Health Centers and SDSU's Institute of Public Health that surveyed drug users found that transportation actually ranked above housing in terms of basic needs. So I would just consider transportation, harm reduction services. I've been shocked to not hear drug use and substance use disorders mentioned more at these meetings, as we know the extreme correlation between incarceration and substance use in this country and in this county. Thank you.
Thank you very much, Robin, and thank you for bringing it up about the language. And then, of course, we're gonna pay close attention to what you mentioned about humanizing our study. You know, because in the end, we talk about numbers and we talk about institutions and trends, but we should never forget that there is people in the middle of this, and we should be thinking about the specific individual that it's in need, and what are those services going to be focused at. I know that Darwin has hand raised. Maybe we asked Darwin to participate, and I don't know if Sarah, you can maybe we can just provide a little more information about some of the services that we've looked at, and in general, and specifically related to substance abuse, just so we can provide a little more comment. But I'll let first Darwin and Amanda comment, and then maybe we can just give you a little more detail on some of the services that we're looking at. Darwin.
All right, thank you. I just want to add, for me, what I'm looking for, and I haven't seen in all the meetings, the stuff that I've been going to for ATI, what I'm looking for is, it's based on my academic side, working as a criminologist at San Diego State University, but also really looking at what I've seen, what I've experienced when I've done ride-alongs with the police, when I was on the community review board on police practices. And it's not going to surprise anyone, of course, it seemed like a lot of what they were doing when I went out their 12-hour shift was dealing with the on-house community and trying to figure out things like, is this drug addiction, is this mental health? And they're not well suited or trained for that. A lot of what they got were things like nuisance calls and trying to decide whether or not they needed to arrest someone. And then with folks that they did arrest, finding out things like the person had been arrested not just multiple times, but in some cases over 100 times. So for me, I'm looking still for data that will support that and get at that. How many people are getting arrested for things like infractions and stuff that starts as infractions or misdemeanors, and that could be dealt with. Again, an alternative does not have to go through the criminal justice system. That to me is the heart of the work and really what we should be looking at the data. And based on what I've seen for other cities, like developing like what we have here, the Mobile Crisis Response Team, MCRT, is one of the ways, as one of the tools that can be very effective. So you have for mental health crises, a non-law enforcement response. There's certainly other areas that could be identified. And if we had the right data to look at things like the criminal offenses, things like whether or not the person's returning, whether or not there are alternative services that could show that they're less likely to be in the criminal justice system if they're not routed through the criminal justice system, that would be really helpful. So I appreciate the comments and thank you, community members, for coming here and continuing to push us to do this work.
Thank you, Darwin, and yeah, you're right. I mean, we still need to gather more data, and we're hoping that as we conclude this this project, we might be able to answer some of those questions when we look at the hard data. So thank you very much for reminding us of that the really important need of having to look at the actual hard data and try to come up with specific recommendations based on the data. Amanda Berry, I think you're next.
Thank you, Octavia. This is Amanda Berry. I'm a policy advisor for Supervisor Lawson Reamer, who brought forward the original board letter on this issue that I'll put in the chat. I think you were about to go into it, Octavia, but I'm really interested in what you're actually learning in terms of the best practices review. In the original board letter, 1C, it's on page 6, if anybody knows, it asks for recommendations the board will be able to implement for alternatives to incarceration that I'm looking forward to seeing in February. And I know Supervisor Lawson Reamer is hoping for really clear recommendations. And the recommendations presented on the slide, like focus on prevention. I'm curious how that can translate into really actionable recommendations that the Board of Supervisors could implement. And like, if you're going to expand on the best practices, what have you seen in other communities in terms of prevention that we should do and in San Diego and invest in, rather than just focusing on prevention? What things can we do and what things are going to be recommended to the full Board of Supervisors to vote on and implement and actually create actionable change in our communities to reduce our jail populations and have people be safer and provided services that they need. So curious if you're, it sounded like you were just about to jump into that when I raised my hand. So thank you for all your work, and I appreciate all of the community members that responded to our email and showed up this evening and next week to engage on this process. It's so important.
Thank you very much, Amanda. And yes, let's, Sarah, to be able to just give us a little more some of the findings that you've had in the best practices section.
Yeah, thanks, Octavio, and thanks everyone for the comments you've raised. I do want to assure everyone that this data that Darwin was discussing about people that are having continuous contacts and where in the population they're coming from, that is data that we are looking at, and it is included in the previous report that hasn't yet been made public. So we are looking into that data. It's just not presented here. We wanted to keep the presentation relatively short so that we could, open the floor for discussion, but we'll definitely take into account that you want to see more of this data at the next one. And then in terms of best practices, you're right, Amanda, that these recommendations presented here are not necessarily tied to specific best practices. They're more generic, but the actual report and the best practices research we're doing does look at specific things that are happening in other communities, whether outside of San Diego County in California, elsewhere in the US, and some internationally as well. Darwin mentioned MCRTs, so we're looking at that model and similar models outside of San Diego County and how those differ from the MCRTs here. So we are looking along the Intercept model at a number of best practices. We're focusing on programs that have been formally evaluated, but we're also looking at programs and practices that that have been recommended or seem promising but have not yet been evaluated. So there are a number of programs, for example, a Project Kinship in Orange County, where it's basically just, you have a van outside of detention centers for when people are released to connect them with services. So we can provide at the next presentation a much more comprehensive outline of these best practices. But we are looking into those. And if there are any specific questions or any recommendations about programs or practices that people would like to raise or they want us to look into or make sure that we are already looking into, please do let us know.
Thank you. Thank you very much, Sarah. And Tom wants to participate. Tom will open your mic in a second.
Yeah, I was going to send this as a follow-up comment, but I'm glad Sarah mentioned use the term promising practices. So I hope maybe you're doing this, but I do hope you, for every example, you have the level of evidence, from a one-shot case study to 2 randomized control trials or meta-analysis. And you probably know about the California Evidence-Based Clearinghouse, and they're a good resource on some of these practices. And then as long as I have the mic here, I wanted to reinforce a comment that Rick McGaffigan made about the sheriff. The CLERB has recommended to the county that they be given authority over the civilian employees in the jails, and that's being mulled over. So I think that would be something that if you could mention in your report, I don't know where that is in the county bureaucracy, but the CLERB is, they don't have a lot of power because the sheriff is elected, but if they have some oversight over the civilian staff at the jail, I think that'll help at least a little bit in terms of the transparency and accountability of what the jail is doing with people that have behavioral health issues.
Thank you, Tom. Thank you very much. Again, the forum's open. If you have any other questions or comments, if you want us to elaborate a little more on recommendations or on our best practices, please let us know. I see some questions in the chat. Robin Sales was asking about the mobile vans outside detention centers. That's in Orange County. And Ben Connor asked if the ATI advisory group and the working group have met together. Yes, they met. The working group is composed not only by law enforcement, but also by other agencies, other agencies from the county, and they've met once, and we're planning to do another session later. So we will keep you all updated about that. I see Jerry. Jerry has hands raised. Jerry, please, your mic's gonna be open in a minute.
Okay, perfect. Thank you. Just because you asked, one really great organization that's been working for about the last 10 years and publishing data and helping counties get up to speed is called Measures for Justice. And they have a tremendous platform that is ultimately basically a portal where all different types of criminal legal system data can be ported into. And it gives a lot of visualization tools and the ability for people to be able to look at different measures, for somebody entering the system and going through our systems. And I think if we look to them and look to Measures for Justice as a model, they also have a thing called the Commons, which is like a community-facing dashboard that Yolo County has been doing. They have some really great examples there, but not a lot of participation from counties in California. And I think, San Diego has an opportunity, and I'm speaking directly to the TA and directly to the public safety group and directly to the sheriff and the police chief, is that we have an opportunity to become a leader in how we use data and how we share data and how we publish data and how we work with the public to try to really work on a community-based system. It is a community-based criminal legal system. I think the days of punitive, system that only thinks of, putting a person away and keeping them off the street, I think that's barbaric now compared to what we know works. And I think San Diego County has the DA has a new 6-year term, the sheriff has a new 6-year term, the supervisors are definitely here and ready to act. And I think it's time. And I think this is an opportunity where we have to really look at ourselves and wonder why we're resistant to engaging the public and resistant to revealing data that might make our agencies look bad. We're not here to criticize agencies and to make them look bad. What we're here to do is to divert people away from prison and jail and get them into the programs they need. And I'll just say for the last 30 seconds that I'm a recovering addict. I've been clean for 38 years. I was diverted basically by a judge that promised me 4 years in prison if he saw me again, and not even a week later I was doing the same thing that got me there in the first place. So I had a chronic problem, and just the threat of prison helped me. And I believe that there's a lot of people out there that can turn themselves into productive members of society, but they need the chance, and we can't do that if we keep putting up barriers. We need doors, not walls. Thank you.
Thank you, Jerry, for your comments. And of course, thank you very much for sharing your life experiences. It certainly provides a lot more context when we know that, there are struggles for our members of the community. And I like what you say. It's just, let's not create more barriers and let's just open doors. And we're hoping that what we're doing probably help opening more doors for alternatives to incarceration. We still have about 20 more minutes scheduled. We are still taking questions or comments in the chat, but also if you want to participate in public, please let us know by raising your hand. In the meantime, Sarah, did I miss anything important in the presentation that we should acknowledge, as we're closing? Did I miss an important data point that you can think of?
Sorry, I was having trouble unmuting myself. I think generally we've covered what we're talking about. It would be difficult to go into all of the data right now without, missing some things. But, given this feedback, we'll certainly be more conscious of sharing more of our data findings, even if incomplete, and specific examples of best practices that we have looked at or that we are looking into. But yeah, thank you, Octavio.
Yeah, thank you, Sarah. And of course, yeah, we wanted to make this this presentation as simple as possible, just to allow for more time for discussion. But we recognize that sometimes it's important to see the data to spark the conversation. So we will definitely revise this this presentation, and we'll try to come up with a much more, I'm not promising a super in-depth presentation because that would take probably the whole 90 minutes, but at least just adding a couple more hard data points that you can look at and you can reflect on and probably comment on. So thank you very much for bringing it up. We really appreciate that your feedback. And are there any more questions from the audience? I don't see any other questions. So just a couple of reminders. Our next community listening session is going to take place next week. It's going to be on Tuesday, January the 31st at 12 p.m. So at noon. We actually decided to have different time frames. So, people that couldn't come during the afternoon could come at lunchtime. So we're hoping that, we can bring other members of the community who weren't able to join today. And of course, you're more than welcome to come to the next one. And, just bringing your comments are extremely valuable, and especially now as we are, kind of wrapping up the research. We're still, analyzing some hard data, as Sarah mentioned. We're still looking into recidivism data. We're still working on the cost analysis. But as we conclude this process, we are in the process of drafting at least preliminary recommendations. So this session and your comments have been extremely valuable and helpful as we start to shape those recommendations. Especially I think one lesson that we can take from this specific community forum is that there are generic recommendations, but there is still a need to have more actionable items. And so we will do our best to translate those generic or general recommendations into more actionable items when we can. And I think one of the best opportunities to do that is part of the best practices analysis, as we start to look into specific programs that have been proven successful or that seem promising. We might be able to provide a little more actionable recommendations. Before I go, I see that Robin McNulty has her hand raised. Robin, please go ahead.
Yeah, I don't think I heard this at a prior meeting, but if I did, maybe you can just remind me. Can you talk about how the results of the surveys have been incorporated or will be incorporated into your findings or your recommendations? I know I brought them inside CDCR facilities and county facilities and distributed them to directly system impacted people. I heard in a prior meeting that there were not as many received as you wanted, so perhaps not statistically significant numbers. That said, I still am hoping that the answers you got would be considered in some way. So could you perhaps just speak about those stakeholder surveys and what's happening with those findings?
Certainly, Robin, and thank you very much for bringing it up. So the specific portion about needs and barriers, it was completely structured based on the results from the survey. So we took from the survey the most important needs and the barriers, and we then we confirmed that with the provider survey. And so that portion of the survey, of the research, was actually completely based on the responses we got. Sorry, and later on, some of the recommendations were actually looking back into not only the specific answers or responses to the survey, but also the open-ended comments that we got from in those surveys. So all of that was actually an important part of the research portion, especially when we focused on the needs and barriers. And I see Richard. Richard, raise your hand. Yeah. Go ahead, Richard.
Oh, just a suggestion when you're going to have another one of these meetings, and I the two organizations that you might want to have to answer questions and maybe support some of the things that you're proposing would be the Director of Behavioral Health Services, as well as a representative from the Sheriff's Department that has to do more with programming and services, because it's great to know, like, how are people being screened, how are they being assessed, and so on, to really know what to remove the transparency, as I was saying earlier, within the jails. But you had talked earlier a lot about all the different programming, and that falls under behavioral health services. And it'd be great to, how are those services linked with law enforcement? Behavioral health services probably have some great, experiences that are probably not being used, advocated for. And that's just a suggestion. I know you're talking about the things that you're doing, but if you want to move the process further, I think those two organizations would give you a great deal of, if they're willing to cooperate, of information and answer questions that we all have.
Thank you, Richard. And yes, we have been working very closely with behavioral health services, and they've been very engaged in the process, and so we are, we're taking a lot of their knowledge and their feedback into consideration. And of course, we are in contact with the sheriff's department, and so this is important because we are the ones conducting the research, but there are many agencies and many representatives from other agencies being part of this process and providing feedback and guidance. And as we move forward, the next step will be how are we able to translate these recommendations that we have and these results and these findings into actionable items. And of course, it's not going to be Sandag by itself is going to be able to do it, but it's going to take the county and other agencies, right, collaborating together to get to place we want to be.
Okay, thanks.
Thank you, Richard. If we don't have any other questions, I want to thank you all for being here today. Again, as I mentioned, a lot of you have come to many of these community forums in the past, and if you haven't, we really thank you for coming here for the first time. We try to, get this information and try to provide a lot of context to the data that we're working on, because again, we only have numbers, but the context, the information that's around it, and what we really need to understand those numbers is what you are bringing to this forum. So we're really appreciative of your time, of your efforts. We recognize your compromise with the community and with those in need and those in risk of incarceration. And we also, as researchers, thank you for your comments and your guidance as well. And of course, for your feedback and your recommendations. We hope that some of the hiccups we had this time around are not going to be present the next time. And of course, we're planning to provide a little more hard data for you to look at in the following sessions. So I see that there is one question from Amanda. Sarah, do you want to go ahead and answer the question for Amanda, because I haven't read it?
Sure. Yeah. So Amanda, thanks for that question. It's a good one. As we've been going about this research, it has been the case that, there are certain questions that we're less confident answering due to either missing data. I think someone was mentioning screening data that's not uniformly collected across agencies when people are initially come into contact with law enforcement. So this is something that's kind of a system-wide issue of, data not being widely available or systematically available. And we do note that where that is the case, and sometimes agencies were hesitant to share certain types of data. And that is an obstacle that we came across. But if you have specific questions about anything like that, please reach out to me and we can discuss. But thank you for that question. That's an important one.
Thank you, Sarah, and thank you, Amanda, for the question. And thank you all again for coming today. Have a really nice afternoon, and I hope you can join us next week on Tuesday the 31st at 12 p.m. Thank you very much.